My name is Cullen. I'm a 26-year-old fourth-year medical student at UVA. I am going into emergency medicine, and as part of that curriculum, during your fourth year, you're expected to go to other hospitals and to rotate there. And the first day I was there, I guess I was nervous. I didn't really feel like I was nervous, but I started to develop a pretty severe chest pain kind of all of a sudden. And I didn't think a whole lot of it, mostly because of my age and because I had never had health problems in the past. And so I kind of just tried to ignore it.
What he felt was this thing starting to tear, and people classically will tell you they feel like they're tearing up inside.
So I kind of just ignored it after the pain went away after a few days and didn't think anything of it until several months later. I was on a rotation with Dr. Eugene Corbett. I had sort of recalled that I had this murmur.
We listened to him, and one of the other students who was with me listened, and we agreed on what the noise was. And he had a murmur. And in a young person, this kind of thing's very rare. So you don't sit on that. So we did the echo, and that's when we noted not only was this one valve leaking, but the reason it was leaking was because the aortic root was actually dilating. I have never had another student, or anybody his age, have an aortic aneurysm that's now beginning to what's called dissect and make the valve leak in my 45-year career.
Basically, as soon as he put the probe on, it was pretty obvious what was going on. Seeing the size of my aorta, it had ballooned out so much that it was causing the blood, when it exited the heart, to go right back in. And I realized immediately that it was going to mean open heart surgery.
When we opened up his chest, and actually when we opened the aorta, and this was really large, it was essentially the size of a coffee cup when your aorta is mostly the size of a banana. And so it was paper thin, and it's just one of those things. Everyone in the room was looking at this and just holding their breath. This thing's a time bomb. It would not be unusual for him to have dropped dead in the next couple weeks.
But I knew it was not a risk-averse procedure. I didn't know if they were going to be able to save my valve. So I knew my life had changed pretty much that day, and it scared me quite a bit.
The operation went very smoothly. His valve is in perfect shape, and the truth is, it should never need to be redone.
I was able to get out of the hospital in about 5 days. Once I got home, I was pretty much my normal self, except for some mild pain. I'm thankful that the recovery wasn't too difficult, and I feel great today.
So glad to see he made it so well, and this grin gets me even more here than it used to. Cardiac disease is one of the top 3 problems we deal with in the clinical world, and the American Heart Association is a good educational resource, especially for patients.
From a patient perspective, the most important thing that the American Heart Association does is just patient education. From a physician's perspective, I think that obviously funding towards research is important. For conditions like mine with aortic aneurysms, there's research into why they happen. There's research into new technologies and new detection, which can make detecting heart attacks quicker and treating them easier. So from those 2 perspectives, I would say that that's the main reason to donate to the American Heart Association.
Much of my early research was supported by the American Heart. I was chair of the Surgical Council at the American Heart nationally. I've been involved with them since the day I started on the faculty. And truthfully, it's a terrific organization. It recognizes cardiovascular disease, pours a lot of money into basic research, and this money often leads to people getting NIH grants and hopefully changing the world a little bit. And there's not a single family I know that doesn't have some history of heart disease. And almost certainly, it'll make a difference for those folks.